Dr. Jasby, in this test that you've developed, you talk a decent amount about variance. So I want to unpack that a bit more, understand what variance is and what the significance of that is.
Yeah, so variance is a very important concept statistically, but also pragmatically. And you may have heard me, or definitely have heard me speak about things and give answers, sometimes very glib answers, with regard to variance. And as a scientist, this is what we spend a lot of our time doing, especially in the molecular sciences and molecular modeling. And our goal is to explain variance, and not just a little bit of it, but we want to explain lots of it. We want to explain lots of it using a very small set of predictors, a very frugal or thrifty model. And so what is this important to? What does this relate to? It relates both to the large scale questions we ask in science, like what layer of the omics is most important? We can answer that in terms of variance, and I have. Or we can ask questions with regard to, what metabolites are most important to early breast cancer etiology, and we can answer that in terms of variance. So variance is, as the name would suggest, a measure of how much things vary, right? So Micah, let's say right now I took a 1 to 10 pain scale rating, okay, from you right now, and in 15 minutes I'm going to take another pain scale rating. From now in 15 minutes, I monitor everything: the text messages you receive, the amount of light in the room, intensity of light in the room, well, I'll measure things like the sound volume. I'll measure things such as, GABA and glutamate levels in your blood, right? I'll measure all these things. And at the 10-minute mark, I'm going to hit you in the head with a hammer. And I'm going to
Why not the
do,
knee?
right. Or no, okay, I guess, but the headache is
Okay.
more, right. I
Yeah,
need a
yeah.
very important thing. So I'm going to hit you in the head with a hammer, right? And then at 15 minutes, I'm going to take the same 1 to 10 scale pain rating for your headache. And now you're going to go from like maybe a 1 or a 2 to like a 10, right? So that is variance. You went from a 2 to a 10. We want to explain this variance in terms of variables, and how much variance each variable accounts for. So we'll look at what was the change, for instance, what happened to, the light levels. Maybe the light was too bright and caused you a headache. Maybe you received a text message that caused you to be upset and get a headache. Maybe you heard a loud noise that caused you to be upset and have a headache. Maybe you had some form of stroke years ago that is only manifesting now in the form of pain in your vasculature, in your cortex. And so there's a ton of things that could explain that variance. The one thing that really explains that variance, though, is the hammer that hit you in the head. We know this, right? That's why I want to use this example. It's very obvious. Now, in the context of biological outcomes, we tease this apart as well. So we like to discuss things in terms of variance. So what's most important to improve patient outcomes? We can explain that in terms of variance. What accounts for the most change, right? If I did the same thing between you, where I just monitored you for 15 minutes, I did that to 29 other people, and then to 30 people here, I didn't hit them in the head. And then I looked at, well, what accounted for this variance, right? These guys have an average change in pain scale of like 8 points, and these guys have an average change in pain scale of like less than 1 point. And so what happened here, right? Like, what explains this significant difference? What explains this variance? It's the hammer in the head in our analogy. But in the context of biological things, we like to explain what explains the most variance in patient outcomes, in patient health, in human health, right? And those things actually come down mostly to a few known variables like diet, exercise, environmental pollution, social connections, right? Like there's various things that account for the most variance. And with a few simple things, we can actually count for 85% of the variance roughly in health outcomes, right? So if we fix these factors, we should get a concomitant, sustainable, and reliable increase in human health, right? And that's what we mean by variance. Or when people ask me, why do you look at the metabolome currently? Why did you start with the metabolome? Why didn't you start with the genome? We have plans to go up to the genome. As you were mentioning with multiomics, this is the holy grail, is to essentially map the molecular human, right? The multiomics man, sort of like a modern day renaissance of the Vitruvian man. And we have this multiomics man sort of conceptualize, and it necessitates probing every single layer. We started with the metabolome because the metabolome explains the most variance in heterogeneous disorders, or disorders, I should say disorders with heterogeneous etiologies, meaning that their onset is not due to genetics or just the environment. It's not like radiation poisoning or Huntington's disease. It is a mixture of both, right? It is a gene-environment interaction disease. Metabolomics explains the most variance in that, so we can use it to account for more outcomes accurately than other levels of systems biology, which are more prone to, like the gastric microbiome, the gut microbiome is fantastic at looking at, some diseases of the GI tract, right, like colorectal cancer, or to look at like H. pylori manifestation. Those are fantastic tools for that, right? But looking at the blood metabolome has proven to be a very sensitive and specific indicator of those human diseases. It accounts for more variance. It is to most of the conditions affecting human health, it is the most important level. I've also talked about variance, with respect to like models, right? Like if we have the outcome is, stage 0 or stage 1, like precancerous or you sort of prodromal breast cancer, right? And we look at the outcome, that is the outcome variable that's stated. We model that outcome variable using levels of various metabolites in certain models, maybe something like chemometric, like a partial least squares model, or something a little bit more machine learning based, like random forest or an SVM model. We can use various tools at our disposal to essentially model metabolites that would predict the onset or the outcome of early breast cancer versus controls, or some sort of comparator groups, or comparator group or set of comparator groups. And so that is the idea of variance, is that these are all structurally linked equations, and they are used to account for outcomes and predict and to some extent the prerequisites for certain events to happen, right? Like the availability of certain substrates for enzymatic activity. Those are prerequisites. And so when we talk about variance, it's really important, because that variance that's what we're trying to do. We're trying to account for lots of variance using a few models, be thrifty in our modeling, and make sure they're not overfit, and then be able to predict new cases using those validated models. That's the whole goal. So when I usually give some responses that are pretty glib. Dr. Jasby, why is it the most important? Why did you start with metabolomics? Oh, it counts for more variance. That answer, again, it contains a very deep meaning that is statistically based. I don't think a lot of people assimilate into their consciousness, but it is a very loaded answer that explains kind of everything at once.
Yeah, and i.e., the metabolism is the most dynamic, meaning that we're going to see lifestyle factors most reflected within the metabolism. And so if your cholesterol is going to be going up, you would first see that somehow represented in the metabolism. Maybe at this point, we can or cannot identify these certain things that are going to happen in these other layers, but
We can.
as we get that,
Yeah, for instance, in the
yeah,
context of cholesterol,
there's
we can look at fatty acid profiles and various ratios of healthy to non-healthy fats, which tell us roughly of the endogenous potential. I wouldn't say quite much the rate, but the endogenous potential of cholesterol synthesis, and sort of say whether this person's metabolism is skewed, or in some ways has a predisposition to hypercholesterolemia. We can tell that with fatty acid profiles much earlier, and at a much more sensitive level than cholesterol testing.
And simply put, the metabolism is the most immediately impactful to human health and the best predictor of what is going to happen with an individual within, a relatively short term, to identify what is happening in the metabolism and how is that going to have upstream effects into the rest of the body, or even within the metabolism itself. And something we talked about quite a bit is with you could well real quick. So with genetics, you could say variance as well, right? Because you could
Hmm?
have these genes. And so if there is a certain disease state like a cancer, they could say, hey, these people with this disease state very often have this gene. So that's predisposition. And I understand predisposition is not as good of a metric as what we can see in the metabolism, which is the actual thing that is currently happening in this individual's body, but maybe explain how variance could be used in these other categories and why it's more impactful in
Right,
the metabolism.
right. So when we talk about variance, we have to have one thing to talk about how much variance, right? We have to have the thing that varies, and we have to have the thing that is trying to predict that thing that varies. So it's not enough to say, I mean, we can say something very like gross and say, how much variance in total human health outcomes does the genome account for? And it's roughly somewhere between 40 to 60%. So let's not split hairs and say it's 50-50, right? So it's like a 50% prediction accuracy, right? What the genome does is set the perimeters of what is possible biologically to be expressed, right? So, like for instance, I want to create a protein, right? I could actually take that protein, like interpolate that gene inside bacteria. We do this in the lab. We do this regularly. We'll turn these bacteria into protein factories. We'll purify that protein, and they go and sell that protein. That's actually the patent of a company, right? Like that is literally a company that my postdoc advisor has founded before, and she was expressing this very tricky protein. I think it's a rhodopsin protein in E. coli. And so we do these interpolations in lab. You take a bacteria, you give this gene, and now it can do something it didn't do before, right? We don't do that, right? We don't do gene editing in humans for ethical and safety reasons. And so we can look at this and say, like, okay, we have this gene that doesn't allow us to create vitamin C. Horses do. They have that gene. We do not, right? But the genes that we have, right, do not only dictate what is possible and not possible. It doesn't say that these things are guaranteed. Everything that happens in this set, in your genome, in this set of biological potentials are just that, potentials. Anything that's not contained in this bounds in your genome cannot happen. You can't grow wings and fly. It's not in your genome to do so, right? But it doesn't mean that just because you have a gene for schizophrenia that it will be expressed, that it will be realized, or a set of genes for schizophrenia. So it depends.
Or you could have genetics that are associated with endurance runners and be morbidly obese.
Absolutely.
Yeah,
right. Right, exactly. It doesn't mean those things whatsoever. And so we have, when we talk about like something like Huntington's disease, we've talked about this before. If you have one gene for Huntington, this gene for Huntington, you will develop Huntington's disease. Now, that is an example of like a gene with deep penetrance. That gene explains like 100% variance in outcomes of Huntington disease, right? 100%. Now you have genes that are more sort of wishy-washy, right? You have genes that are like, okay, something for like, I don't know, widow's peak. That's about like, or even like the BRCA1 gene. The BRCA1 gene accounts for like anywhere from like 20 to 80% variance. So it depends on the individual, right? That's where personalization comes in. But roughly we see a range of between 20 to 80% predictive. You could get a test for BRCA1 and it would sort of show if you have a 20% risk of breast cancer or an 80% risk of breast cancer, which are polar opposites, basically, right? Might as well say 0 to 100. And so that gene is kind of weak. And then we have genes that are kind of in the middle, like the ApoE4.
A quick question too, but there's also lifestyle factor mixed into that. So isn't
Absolutely.
that taking 80% of the average person, not including people who are making the proper lifestyle and dietary and supplementation adjustments to mitigate that, correct?
Right. That statistic doesn't differentiate that. It has to do with breast cancer symptoms reported and presence or absence of this BRCA1 mutation. I say BRCA. People say BRCA.
So, I mean,
depends.
it's just saying like, hey, based on the broad population, there's an 80% chance if you follow, if you're the average person, that you will develop this disease state. But it's not necessarily telling you, it doesn't really give you an actual accurate predictor to that, because then there's all the lifestyle modifications
Yeah.
you can make to mitigate
Yeah,
that.
that's essentially like 50% chance. Like you got a 50% chance, the average person without even being tested, right? But we know that there's these key things you can do that lower the expression of potentially harmful mutations related to breast cancer or Alzheimer's or Huntington, or not Huntington. There really is only staving off that disorder. So we have some things that we can do for breast cancer, right? Are you a smoker? Smoking status significantly increases your chance of breast cancer. Are you overweight or obese? These sorts of additional, high BMI individuals do show very increased risk and chance of developing breast cancer. Are you on any sort of hormone therapies? Previous history of abortions can increase or modulate risk of certain gynecological cancers. So these are important factors to consider. And that's where metabolism comes in, because most of the disorders that, again, are the greatest contributors to our morbidity, human mortality. Those are not disorders that are just linked to one or two or even a handful of genes, right? Those are the really convenient ones. And we've kind of figured those out. We may not have a treatment for them, but diagnosing them and providing some sort of palliative care is absolutely possible. They tend to be, of course, they're inherited and they tend to be devastating and oftentimes lethal. The, mutations that are related to the more severe inborn errors of metabolism, if not rectified in early life, lead to lifelong disability or death. And so these are the genetic disorders, they usually will be suddenly manifest, powerfully manifest, and lethal. The ones that are killing us the most, right? Most individuals are not dying because of Huntington. Most individuals are not dying because of phenylketonuria. Most individuals are dying because of cancers, heart disease, cardiovascular events, neurodegenerative decline and degeneration. So those are the big culprits, those are the usual suspects. And so how do we diagnose those earlier, cheaper, faster, less invasively, and provide greater and enhanced treatment options? That's the metabolism. That's what we utilize. Yeah. Do you have any other talking
Yeah, I
points?
mean, I do think that it's the most useful layer of systems to profile because I mean, what is the benefit of profiling genetics? Is you can see some of the predispositions, but it's the things that you change in your life, the modifications you make to your lifestyle in order to mitigate the risks. So you learn about the predispositions that you have, and then through the modification of your lifestyle, you mitigate those risks. However, you can just go right to the metabolism, identify exactly what are the areas. Maybe you do need methylfolate. Maybe you don't because you're getting enough folic acid in your diet. And that throughput, we have enough of a pool over here that we're developing enough methylfolate. Or just as an example. But
Mhm.
I think it's giving you more actionable results based on where you're at right now rather than setting the confinement of what is your predisposition. So I see it much more helpful because that's now also dynamic, meaning that over time you can adapt that, you can monitor it, you can adjust it, and you can get more intelligent with how you're mitigating these different potential disease states. So I think this global profiling that you've developed is really helpful because now we can identify is there an issue in inflammation? Is there an issue in nutrition? Is there an issue here or this pathway? And that we can supplement or modify that pathway so that it's more conductive to health overall. And so I see it just as a much more helpful profiling than genetics.
Really do want to stress the fact that, the genome is just the total set of what is possible. Like I said, if you don't have the genes for growing a wing and flying, you're not going to. Um, so it doesn't mean that what you do have, harmful or beneficial, is going to be expressed. You could have the genes for schizophrenia, doesn't mean you'll be schizophrenic, or you could have the genes for long distance running and you could be morbidly obese. It doesn't mean that you are necessarily your genes. You are not your genes, um, but your genes are you. Does that make sense? Like your genes are the total set of what's possible, the possible use, right? And so keep that in mind that they're not guaranteed to either, the beneficial ones or the harmful ones to be expressed, but you are guaranteed that you won't be able to essentially go beyond your genes, in the sense of, becoming a whole foot taller or growing wings or changing your skin color or something. That's not, usually possible without some sort of genetic disorder or uh, gene editing. So that's what I would tell people to keep in mind. And the fact that the metabolism is, again, the most sensitive and dynamic, and because it's dynamic, it provides this snapshot, this tool that you can use repeatedly to reassess, readjust, and keep engineering your health trajectory into a more beneficial and optimized state.
Well, I'd like to tell the listeners that if you would like to learn from Dr. Jasby directly, we have a live training event coming up June 28th and 29th of 2024 in Phoenix, Arizona. So if you would like to check out this event, learn how to clinically apply personalized, like really, really personalized medicine into your clinic, and also learn how to use AI to create custom protocols for your patients, then I highly recommend coming to this training, learning from Dr. Jasby, Dr. Moore, Dr. Gail King, which is coming up, like I said, June 28th and 29th. And you can go to the link that you see on the screen here, which is therio.me/event.